Hi, Dr. Ramsey Choucair. We're continuing our series of videos to help educate patients about cosmetic plastic surgery. Today we're going to talk about whether you should have your breast implants removed. This is a topic that's been in the news recently. And it's a difficult topic because there's many variables. And with the information patients can read on social media and with Dr. Google, it's not bad. We want that information, but it's not all filtered and it's not all necessarily based on science. So here's the story about breast implants as we sit today in 2020. We know that if you have saline implants and they are not the textured or Velcro type surface that have been recalled, the implant's either okay or it deflates. There's really nothing forcing your hand to remove those implants. That's a generalized statement. It depends on each individual. And if an individual comes to see me who has saline implants, even if they're smooth, they're not the Velcro surface that have had some issues, in general, we don't recommend removal because the implant, again, is either inflated or it deflates and you know it. That's the beauty of a saline implant. But if patients are coming in and they're having symptoms or complaints of anything, it really becomes the patient's decision if there's not a strong medical basis for removing the implants. And we're respectful of that. You have to be. It's their patient's body. It's whatever they feel comfortable doing. Of course, the aesthetic result of the cosmetic appearance will change, but many times at some point in life, the patients are less likely to consider that a priority. However, if you have silicone gel implants and they are, again, not the textured Velcro surface that's been recalled, we're not talking about those. Those we're recommending at some point that you remove them unless you have a more urgent issue, which is, again, in general, sudden swelling in the breast in a textured implant. That's a different story. Then we're more aware of moving that along the timeline. But if you have textured implants that have not caused a problem, and they're not the ones that are recalled, we still don't recommend that you remove those. Certainly if they're smooth silicone gel implants and you have had no issues and your mammograms are normal and you're not having any, again, complaints, and again, you have had a sonogram or an MRI that shows the implant's okay, then it's a personal choice to remove those implants. So the bottom line, even though it sounds somewhat confusing, is it's the patient's decision whether they want the implant removed, no matter what kind it is. And it's the doctor, the physician, the surgeon's responsibility to sit with you, because each case is different, and go through concerns and valid medical information about whether those implants should be removed. And if you elect to have them removed, then of course the decision to do that should be a mutual one. So I hope that helps. It's a general thought process that I think is important for most patients to know. Now, if we talk about saline implants in general, now we're switching to just saline implants, whether they're the Mentor textured or a smooth implant. There's really nothing forcing your hand to remove that implant because you know it's either inflated, which you can tell, or it has a leak and it gradually deflates. And you know that too because your breast becomes smaller. And then you simply take the old saline implant out and you put a new one in. That would be what you would do with saline. So, you don't need to do the surveillance that we recommend for a silicone gel implant, which is typically an MRI every 5 years, or at least the newer high definition sonograms, which can tell whether a silicone gel implant has any issue with the integrity of the surface of the implant. So that hopefully helps you understand, the differences between the one that's been recalled, Allergan, textured implant. That's the only implant that's been recalled. Now, many patients, despite all these issues, have concerns about their implants, even if they're not the implant that's recalled. And that's where you really need to consult with your plastic surgeon, go over any concerns you have, any symptoms you have, and make a decision about whether potentially removing that implant is something you want to do, even though the cosmetic result will change. You will be obviously smaller and less full, but at some point, some patients make that decision, again, with good advice from their plastic surgeon who's evaluating them individually. And if you decide to do that, there are basically very straightforward procedures that remove the implant with hopefully very little recovery. Again, that's a generalization. But the key is to talk to your plastic surgeon and determine whether, in your case, those implants are something you want to remove. So I hope that helps.